Hello, I'm Lisa Cheek, Director of Nursing and Midwifery here at the RUH. I'm asking you today to join us in making a renewed and even bigger effort to stop the spread of coronavirus in hospital, in the community and in your home. We're calling on everyone to do their bit to help stop the spread of this terrible virus, to protect themselves and others and to reduce the demand on services here at the RUH. We're just coming out of seeing a serious peak in the number of COVID positive patients at the hospital and an increase in the number of staff who have had the infection. And this has put a huge burden on our teams and threatened our ability to maintain all the other services we provide. And that's why we've introduced some even stricter measures on top of those we put in place back in the spring at the RUH, such as reducing the number of public entrances, providing manned stations that are providing PPE, face masks and hand gels and social distancing advice. And we've done this because there's a real risk in the rise of the number of COVID-19 patients needing care this winter and to address the so-called coronavirus fatigue that many of us may be feeling. So if you come to the RUH, you'll notice more information posters and signs reminding you to wash your hands, to wear a mask and to stay at least 2 meters apart. And with visiting currently suspended, you may be asked by our staff if you really need to be at the hospital. We'd like everyone to ask themselves, is my journey to the RUH really necessary? Because the fewer people here, the safer it is for everyone. Of course, our A&E department is open 24/7 if you do need us. So please don't ignore things like chest pains, breathing difficulties, head injuries, or if you've been involved in an accident. These are emergencies and we are here for you. We're asking for the same vigilance amongst our staff too, to be scrupulous in their hand hygiene, social distancing and PPE wearing in and outside the hospital. We all have to remain vigilant until mass vaccination is widely effective. It will take some time, but until then, it's so important that everyone who comes to the RUH, our patients, our visitors and our staff, plays their part in helping to prevent the spread of this infection. We all need to be personally responsible to keep ourselves and others safe.